A very important session. It deals with transforming public health professionals, training in Sierra Leone, confronting challenges, and seizing opportunities. This is a very important area when it comes to the issue of public health in Sierra Leone. And public health is a major field. It's a huge field, very interdisciplinary, very big. And
my name is Dr. Alhassan Fuad Kanu. I'm the Chief Executive Officer, the founder of the Institute for Health Professional Development in Sierra Leone. Okay. IHPD is the idea of Sierra Leoneans here in Freetown or in Sierra Leone locally, and colleagues abroad who are scholars, who are practitioners. I had the experience of working with the Ministry of Health and Sanitation, now the Ministry of Health. I came to realize that we need what I call continuing professional development, which is really not a common practice. And as health workers and health being dynamic, you need to reskill, to retool. You need to be updated. So IHPD is here just to foster that kind of practice where we can encourage or support the mid-level manpower.
Healthcare is expensive. That's a fact of life. Okay? Maternal child health, mortality rates, disease prevalence, and incidence. We have some diseases that we can manage better now. Prevalence rates may be stagnated, maybe they are going up. The new cases that we call incidence rates are there. How do we address them? In which area?
Yesterday, 25th of April, I was inducted as a fellow of the African Institute for Public Health Professionals. This is a milestone for my career pathway, but not only a milestone for my career pathway, but a milestone for the country at large, because I meet with other public health professionals, not only in Sierra Leone, but I will be networking and collaborating with other public health professionals in the sub-region. The reason why we are an umbrella body as a chapter under the African Institute for Public Health Professionals. So it's been an inspiration for me to be part of this very, very important body in Africa. And I want to say that I hold that in high esteem, and I'm sure we will work together to improve on the public health systems in Sierra Leone and beyond.
Ladies and gentlemen, this event is called to order. May I please ask that we stand to invite the procession. Please let us rise up.
My name is David Kanu. My organization is UNICEF. I'm currently working as a vaccine management consultant for UNICEF. Being inducted into the African Institute of Public Health Professionals is a big achievement for me. Inasmuch all the roles, the functions that I've been doing right there at peripheral health units, going at disease level, they have never come to a public view. But the African Institute of Public Health Professionals made it possible that my achievements my contributions towards my country, Sierra Leone, come under a public view. So I thank God for that.
Reverend Dr. Titi Sanga.
Yes, some of my experiences for the past 2 days, but I want to say even for the past 3 days. Interestingly, I have been part of the committee working, to actually make these few days a success. The first day that we had a public health seminar, it was really, really an interesting one. From the evolution of public health in Sierra Leone and bringing them together to share their experiences. I was one of the panelists focusing on women's health. And I had to, from experience, what we've learned about women's health, especially in Sierra Leone, is that the public health system in the past decades have not done any justice towards women's health. We've seen how there is a huge health disparity. So having the IHPD to actually shoulder such a huge responsibility to bring public health professionals together to deliberate on some of these issues, from the evolution, moving to transitioning, and also looking at the challenges and what opportunities are there for us. There is hope for the future. There is hope for the public health system in this country.
Health being dynamic is about networking. When you network, you share experience. So we have this African Institute. It's a regional professional networking body that covers 50-something countries in Africa. So for us as a Sierra Leone, we are today the first in the region that has created a chapter of the Institute. For you to be referred to as a fellow, it means you have the competencies required, i.e. the qualification, but also you need at least 10 to 15 years of experience. Being a fellow, you are now required from time to time to publish abstracts, to attend conferences in and out of Sierra Leone. And you know what it means? Once you are out there, you are going to bring in a rich experience that will inform policy and practice locally as a country. So having over 150 fellows, and among them you have full members and also associates, I think is the best way to go in terms of experience sharing, in best practices, innovation, and the like. So I'm pretty sure the outcome will be, it means a whole lot with regards how we can work for the health improvement of our people.
Excellent policy.
Thank you very much. Great to see all the nurses and midwives. I think
at IHPD, we currently have affiliated institutions outside of Sierra Leone. We have collaborative research opportunities, but until you relate with another school or institute. So being IHPD, working alongside AIPHP and other institutions across the world, it will help us to get the right manpower that we can fly into Sierra Leone to support our local health workforce.
Dr. Lawrence is a prominent academic and researcher based in Sierra Leone, currently serving as Dean of Postgraduate.
AIPH has been going from one country to the other on a yearly basis to have these conferences. And this is the first visit they are doing to a country just to establish and launch a chapter here in Sierra Leone. I was with them in Ghana as a keynote speaker. I met them, I lobbied around to say, hey, we need this opportunity. Come to Sierra Leone. And thankfully they are here. We want to host the next conference here. I will be with them in South Africa to deliver a paper, and hopefully with some colleagues now who have just been inducted. So we want the next conference to be held here in Freetown, and I'm pretty sure they have seen our facilities. We will be able to really accommodate them, to host them. And it will mean a number of countries in the sub-region of Mano River or ECOWAS and Africa generally they will be able to converge here in Sierra Leone.